Hey everybody, it's Dr. Jonah Yakel, your natural health care practitioner, and I'm excited to be sharing with you part two of our functional medicine series. And today I'm going to be discussing blood sugar, which I think is extremely relevant in today's day and age with the severe increase, not only in diabetes, but pre-diabetes. It's currently estimated that half of us, 50% of all Americans are pre-diabetic. And the reality is that blood sugar issues drive so many of our other health challenges. So if we can get to the root of this, we can really have an enormous impact and influence on our overall health and well-being, including impacting things like inflammation, which we talked about in the last video, impacting our hormones, impacting, obviously, as inflammation goes down, pain, mood disorders being correlated with blood sugar issues. So, I mean, we can have an enormous impact and really empower and transform our health and well-being by learning how to master and manage our blood sugar issues. Before I get into that, I'd like to just spend a minute. I had several questions after the last video, people wondering, what in the world is functional medicine? And I love that question because the reality is functional medicine, more than anything, it is the practice of getting to the root cause of what's making us sick. Let's face it, our healthcare is really great at finding out what's wrong with us. If we go to the doctor and we're not feeling well, we fully expect to walk out of the doctor's office knowing exactly what it is that we have. We expect to have a diagnosis. And furthermore, we're usually going to walk out of there with some kind of prescription or medication that's supposed to solve that specific problem or whatever that what is. But functional medicine is entirely different. It is about getting to the root cause. It's about finding the source, the why behind why we're sick. It's not what do you have, but it's more a question of why do you have it? So it's looking at patterns. It's spending more than 8 minutes with our clients, spending 30, even upwards of 60 minutes with people to really root out the underlying cause, to find the weaknesses, find the imbalances, find the upstream sources of why we're sick, as opposed to just treating the symptoms. So really, it's a whole body approach to healthcare. And I think that this is really the healthcare of the future. And I think that the future is now. And, in my practice at LifeGate Health Center, the goal is not only to find the cause, but it's to provide 100% natural solutions to start, as opposed to treating symptoms, but to start strengthening the system. And I think that this is more important than ever. I'm just going to share a slide here. But what we now know is that, we have to understand that health is not a destination. For me, functional medicine is really a lifestyle. It's about instilling the patterns and the behaviors that are not only going to help me feel healthy today, but they're going to maintain my health for the next 10, 20, 30 years, right? But the reality is at this point, 75% of Americans are overweight. And a new report came out just recently that said half of us have heart disease. Half of all Americans have heart disease. That's incredible. Another half of Americans are pre-diabetic, where 33% of those are actually in a state of diabetes. 25% of Americans will at some point get cancer. 22% of Americans have some form of mood disorder, anxiety, depression, ADD, ADHD, even things like bipolar and schizophrenia. Even addiction. We know that 1 in 5 Americans struggle with addiction. And the reality is if we throw in our food addictions and really our sugar addictions, we have to understand that sugar is a drug, and it is the most easily accessible, and it is the most abused drug in our country. And part of this, to some degree, is our blood sugar issues are not entirely our own fault. They are our responsibility, but it's not our fault per se that we're addicted to carbohydrates and addicted to sugar. 200 years ago, the average American ate 2 pounds of sugar a day. In this day and age, fast forward 200 years later, the average American is consuming about 150 pounds of sugar per day. So in essence, we're consuming 3 pounds of sugar a week. Our ancestors consumed 2 pounds of sugar a year. We eat more sugar in a week than our ancestors did in a year. It's no wonder that these numbers are sky high. It's no wonder that we're struggling so much with our health. And even with all the new advances in modern medicine, which is no doubt keeping us alive longer, it's impacting our quality of health. So yes, we might be living more years, but what is the quality of those years? I don't want to just live another 10, 20, 30 years. I want to live exceptionally for the next 10, 20, or 30 years. And so that means overcoming some of these addictions, changing our lifestyle, and really empowering ourselves. I think this is the most exciting thing, is that this is probably the number one thing that I do in my practice that changes all people's health outcomes, is getting people off the carbs. And like I said, this isn't entirely our fault. Our food industry drives these. All the advertising. You'll notice when you go to the grocery store, all healthy food is more expensive than the cheap food. Fast food tends to be a very inexpensive way of eating. But again, all of this just further drives our addiction. So even though it's not our fault, it is still our responsibility. So we want to overcome. And we want to start breaking those habits and those addictions. And that's one of the main things that I'm going to be talking about today is our blood sugar issues. But, before moving on from functional medicine, you'll notice this tree here. And ultimately, functional medicine is the practice of getting to the root cause. And what you'll notice up here in this tree is this is where all our symptoms emerge. And whenever we have a symptom, we go to the doctor. And depending on the symptom, we might go to a different doctor. But, we go to one doctor for our cardiovascular problems. We go to another doctor for our hormone issues. We might see a GI doctor for our digestive problems, or, a neurologist if we're having neurological issues. But again, the reality is that all of this is coming from downstream or upstream issues. So this is what functional medicine is all about, is that we know that all of these symptoms are just that. They're symptoms of a bigger, deeper imbalance. It could be coming from our diet. It could be coming from our sleep. It could be coming from environmental pollutants, or our stress, or our exercise, or lack thereof. So functional medicine is really about getting to that root cause, because we know when we can get the roots healthy, the rest of the tree is going to start to change. So if you're tired of treating symptoms and just chasing after one symptom after the other, this is the way to go. This is the future of healthcare. Working with a natural health or a functional health practitioner to start unrooting or discovering what is at the source of your health challenges. Which brings us to our topic today, which is really, again, it's all about blood sugar. We know that this is one of the major drivers for a tremendous amount of our healthcare challenges. Again, whether we're dealing with inflammation, whether we're dealing with hormone imbalances, whether we're dealing with mood disorders, anxiety, depression, even our sleep is highly influenced by our blood sugar issues. And the reality is that, again, our ancestors primarily derived their energy from fats. And in fact, our body is designed to burn fat very, very efficiently. On the other hand, it burns sugar and carbohydrates very inefficiently. It'd be like trying to run a bonfire with leaves. Like, you can do that for a little while, but eventually, it's going to burn out very quickly. And furthermore, it requires us constantly putting more leaves on the fire. It's like I like to say, this is why we can eat a giant bowl of pasta for dinner, and we need a bowl of ice cream or cereal right before bed. It's like we're already hungry. It's like we just burn through all of these. And then, of course, the sugar does not provide us enough energy to even get through the full night. So what happens is when our blood sugar drops in the middle of the night, we get a little surge of adrenaline. And ultimately what happens is that wakes us up between 3, 4 o'clock in the morning every night. That's primarily a blood sugar issue. So the goal here is we want to address the blood sugar. How do we learn to manage that? So whether we're pre-diabetic, whether we're diabetic, or whether we're none of those, the reality is in our country today, you cannot eat and live off a standard American diet and not have blood sugar issues. So again, returning here to the slides, when dealing with blood sugar, it's just important to realize that there's two forms of blood sugar issues. The one that we're most commonly aware of would be what's called hyperglycemia, high blood sugar. So this is what we think about when we think about type 2 diabetes and things about like insulin resistance is, that blood sugar, those glucose levels going high. Ultimately, we want our blood sugars to be under 100. So if they're over 100, we know that we've got an insulin resistant issue. And then, of course, once we're insulin resistant long enough, we're going to start increasing our A1C levels, which is primarily the measurement they use to determine if someone's pre-diabetic or diabetic. And A1C of 5.7 or above is pre-diabetic. Once it gets above 6.2, we're actually considered to be diabetic. So this is primarily what we think of when we have blood sugar issues. However, as I mentioned, we really can't live in our world today without having some form of blood sugar issue. And that brings us to the second type of dysglycemia or blood sugar imbalance, which is hypoglycemic. So this is what would be considered typically someone with low blood sugar. The reality is, though, we don't technically have low blood sugar. What happens is our blood sugar goes high after we eat a high carb meal, whether that be anything with, breads or pastas or white potatoes, rices, things like that, anything that's going to increase our blood sugar is going to go high, but anything that goes up is eventually going to have to come back down. So this blood sugar is going to crash, and it's going to leave us in a state of hypoglycemia. So the reality is most Americans have one or the other of these, and many of us actually have both of these. And so often I'll get people in my office who struggle with hypoglycemia. However, when I bring up or we start discussing blood sugar issues, they're like, well, I don't have blood sugar. I have low blood sugar. The reality is that low blood sugar is being caused by the same thing as high blood sugar. So most of us actually, to some degree, have both of these issues. So how do we know? How do we know if this is what we're dealing with? How do we know if we're struggling with hyper or hypoglycemia? So hyperglycemia, this is having high blood sugar. Some of the symptoms of this is one, just gaining weight, especially abdominally. So when we start getting that weight around the abdomen or the belly fat, or we have difficulty losing weight, those are primarily hyperglycemic issues. Cravings, if you're one of those who's constantly craving carbohydrates, that again is a good sign of hyperglycemia. And again, addiction is really at the root of our blood sugar issues because we keep going back for that energy source, because every time that blood sugar crashes, we don't feel good. We get anxiety, we get anxious. We start getting the cravings. Some people might get a little lightheaded. Some people might get nauseous. You might get a little trembly if you're getting shaky. Those are all signs of hypoglycemia, as well as hyperglycemia. So fatigue, if you find that every time you eat, you're suddenly feeling exhausted, this is a sign of hyperglycemia. Few people are aware of this, but cortisol, which many of you have probably heard of, which is our stress hormone, and we know how bad chronically high levels of cortisol can be bad for us. But what a lot of us don't realize is that cortisol is also the hormone that regulates and balances our blood sugar. So when our blood sugar drops or goes up, we're going to get another increase in cortisol in order to balance that out. The problem is we start experiencing anxiety, and eventually that's going to turn into burnout. Hormone dysregulation, so testosterone issues in men, PMS, perimenopause, all of these are oftentimes correlated to blood sugar issues. And I've found that 9 times out of 10, when we get the blood sugar balance, people's hormones balance out as well. Blood sugar issues are going to cause more inflammation. So again, we have more pain in the body. And as I mentioned, 50% of Americans are in a pre-diabetic state. Now, on the other hand, many of us suffer from hypoglycemia. So the symptoms of this might be different, as I mentioned. So, if we can't go, more than an hour or two between, meals and eatings, and when we do, we get anxious and we get irritable and we get shaky and lightheaded, that nervousness in between long meals. In fact, I hear this referred to in my practice as being hangry. It's like we get angry when we go too far, when we get too hungry. That is not normal. That is a sign of our blood sugar crashing. Frequent headaches, difficulty focusing, blurred vision, brain fog, energy. A good sign of hypoglycemia is if you feel boosted after you eat. So With hyperglycemia, you eat and your energy crashes. With hypoglycemia, you eat and you suddenly feel energized. I mentioned the brain fog, the decreased cortisol levels, which ultimately is going to lead towards adrenal fatigue. And then, of course, hormone dysregulation is also going to be a big side effect of that. So, whether we're struggling with hyperglycemia, whether we're struggling with hypoglycemia, so many of us are struggling with both. You can see where this drives so many of our health challenges. In fact, high blood sugar has been correlated with cardiovascular disease. So we used to think that was being driven by high fat diets. We now know that cardiovascular disease is actually being driven by high carbohydrate diets. Same is true for cancer. So often we wonder, is there a link to our diet in cancer? Now, cancer is multifactorial, and we can't say that blood sugar issues cause cancer, but we do know that it can drive tumor growth. So, being aware of the reality that not only is blood sugar problems causing diabetes, but it's also driving inflammation. It's driving hormone dysregulation. It's driving cardiovascular problems and cardiovascular disease, potentially even driving cancer and tumor growth. So again, I'm not real sure there is a more profound or transformational way for us to empower ourselves and take control of our own health than overcoming our own sugar addictions and getting off the carbohydrates. So now we know. It's like, okay, here's the problem. We're dealing with blood sugar issues. Again, whether we're pre-diabetic, diabetic, or haven't even gotten to that place yet, most of us are struggling with this to some degree. So what do we do? Well, I have found in my practice consistently that about 80% of my practice is going to profoundly be affected by simply a few steps. And so those steps are really primarily going to be getting off the carbohydrates. So rule number one, which is by far the most important rule, is getting off not necessarily all sugar, although of course that's the goal, but most important is getting off the starchy foods. Starchy foods have a tremendously powerful impact on our blood sugar. So what is a starchy food? I'm talking about bread. I'm talking about pasta. I'm talking about white potatoes. I'm talking about rice. Really all grains. These are all going to be very starchy, and therefore they're all going to have a huge influence on our blood sugar. So this is goal number one, bar none. If all you do in your life is get off the starchy foods or limit them dramatically, your health is going to transform almost overnight. So this is a paleo diet. This would be a ketogenic diet. This would be a Whole30 diet. In my office, I often do a phase 2 diet, which is kind of a combination between a paleo and a Whole30. But bottom line, getting on that low carb diet. But it's also important to recognize that as we start removing the sources of sugar and carbohydrates from our diet, your energy levels are likely going to crash in the beginning. So we have to fill those in with eating really healthy forms of protein and fat. So as we take out the carbohydrates, we want to replace it with fats and proteins. So we want to eat protein at least 3 times a day. It doesn't even have to be a lot. We're looking at maybe 6 ounces per day. High quality protein and fat for breakfast. We've all heard breakfast is the most important meal of the day. And I would absolutely have to agree with that. But we're not getting up and eating oatmeal for breakfast. We're not eating pancakes. We're not eating muffins and bagels. And all of these things are blowing up our blood sugar. It's the worst thing that we could do is right out of bed, go for a food source or a fuel source that is going to drive up our blood sugar. This is just going to lead to a crash a very short time after that. So eating, high quality fat, high quality protein. I eat eggs very frequently, but believe it or not, you can get away with eating things like bacon, eggs, sausage, but I always start considering eating things like dinner for breakfast, getting those vegetables in early in the morning. I know it sounds totally crazy. It's a different approach. We've all done breakfast for dinner, What about doing dinner for breakfast? Eating every 2 to 3 hours. This is especially important for someone who's just starting out. We don't want to necessarily, or we don't even need to go on calorie restriction. We're not trying to fast. We're just trying to change how we eat. But in the beginning, especially, it's important that we eat every 2 to 3 hours so we don't get that drop in blood sugar that leads to us going into a high state of cravings, which always leads to us crashing and burning and making some poor food choices. Avoiding carbohydrates before bed. So, again, eating a high quality animal protein or fat right before bed. This can be really great. I love a little bit of turkey with some avocado, maybe a little bit of tomato in there. We'll give a little bit of carbohydrate. That's a great something to snack on before bed. So it's like avoiding the chips, the ice cream, whatever it is right before bed, and going for a high quality protein or fat. Getting off fruit juices. Fruit juice can be just as bad as soda. They're so high in sugar. So we're getting off, all of the processed sugars, but that even includes fruit juices. And then, of course, fruit in itself is a very, very healthy source of all of our, vitamins, minerals, antioxidants. However, they too, if we're going to if we're getting off all the starches and we just replace them with eating lots of fruit, that too can be almost too high sugar. So we want to limit our servings of fruit to 2 to 3 times a day, no more than 2 to 3 servings per day. And ideally, we're picking low sugar sources like berries, apples, cherries. I love blueberries, strawberries, blackberries, things of that nature. So the honest reality, as I mentioned before, is that these are the steps to getting our blood sugar balanced. And I found that 80% of the time, if this is all I do with clients, they are going to get transformation in their health. Their inflammation is going to go down. Their brain function is going to start improving. Blood sugar will balance out very, very quickly, unless you have an advanced state of diabetes. Then it can take a lot longer. Even things like cholesterol are hugely impacted by our diet. We have to recognize that food is medicine, and it's probably the most powerful medicine that we can utilize every day. Like, I see this stuff outperforming drugs all the time in my practice. We can do more in a month. We can get more change in people's chemistry in a month's time through diet than most people get on these medications that, let's face it, we're expected to be on for the rest of our life. So if we can just step in and start making some little changes, we can get huge transformation in our life. And it starts as simply as getting out getting out the carbohydrates. So, as I mentioned, 80% of you, if you do this, you're going to start changing overnight. I do find that about 10 to 20% of my clients who have more advanced health conditions, they need some oversight. They need a little extra support. So if you're already dealing with blood sugar issues, you definitely are going to want to find a healthcare practitioner, ideally a functional health practitioner that you can work with. If you've got one that you love, I encourage you to have this conversation with them. If you're not working with anyone who's knowledgeable in this field, I'd be more than happy to help support you in any way that I can. But good luck. I'll look forward to our next video in 2 weeks. We're going to be exploring another topic. Primarily, we're going to be diving into hormone dysregulation. So stay tuned. A few weeks from now, you'll be getting your next video series on functional medicine. Until then, if you have any questions or you're ready to take that leap, you've tried doing it on your own, you haven't been successful, please don't hesitate to reach out, email, call the office. We're more than happy to support you and help you transform your health and reach all your health goals for 2019.